hot yoga is the one bane
Mm.
of the dermatologist's existence sometimes. And you have to get into those conversations of like, oh, do you happen to do hot yoga? And often that comes out that they're doing something that really brings up their core body temperature.
Mm.
It can flare in a day.
This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and I am speaking today with Dr. Jennifer Linder. She was most recently on the podcast, the same season, season 3, episode 6. We talked all about skincare and chemical peels. So if you haven't listened to that, go back and listen. It was really fantastic, really great discussion. And we had so much to talk about that we wanted to come back and talk to you today about melasma. So Jennifer, thank you so much for being back on the podcast today. I can't wait to talk about this.
My absolute pleasure. This is definitely one of my favorite things to talk about. So let's get into it.
Yeah. So Jennifer is a board certified dermatologist, and she happens to have a lot of personal experience with melasma and treating it. So I think you're the perfect person to talk about this. Can we start by explaining exactly what melasma is before we talk about what we have to do about it?
Yes, please. So melasma is a hyperpigmentation. It's typically on the face, but it actually can present in other parts of the body. It can even present on the chest, the arms. Usually, if you see pigment on the neck, that's something else called Poikiloderma ovale. But it can get confused with other things. But in general, if you see a patch, especially on the face, and you can outline it like a little island, that's a good sign that it's melasma, especially if it's symmetrical. It usually presents the cheeks, the nose, sometimes on the forehead, sometimes on the upper lip. Unfortunately, the upper lip can be a little bit of the more difficult place to treat, but we can definitely do that. And then sometimes even along the jawline. So we used to call it the mask of pregnancy, and that is because it has such hormones are a very common trigger, and because pregnancy is a time when we get that really change in hormones, obviously that is often a trigger for it. In that same sense, hormones related to birth control can be a trigger. Hormones related to hormone replacement therapy can also be a trigger, but it can happen just out of the blue. And it can even happen in men. So it is not just a female focused thing, although the vast majority, probably more than 90%, does happen in women because of the hormonal component, but it can happen in men as well.
So people are coming into the office and they have these new kind of geographic patches of brown pigment on their face. And it can happen in any skin type, right? It's very, very
Absolutely.
common actually with darker skin types. And they don't like it, right?
Nobody, it looks like a dirty spot in your skin. And the interesting thing is, melasma has one of the highest, what we call quality of life effects in terms of people may not realize how much it really internally affects people. I've seen patients who really will not leave their house without makeup on. And I think
Oh,
it's
yeah.
often one of these quiet things that people sort of hide away about how much it bothers them. I don't know if it goes back to sort of like an ancient thought process around somebody feeling dirty or whatever it may be. But I think it's also related to sunspots and hyperpigmentation are often one of the first signs of aging. So because of that, I think when somebody has melasma, they also look a little bit older than they would look without it. So
Yeah,
these are some of these little subtle things that I
that's
think
true.
affect people psychologically that we don't necessarily realize is underlying.
Can you explain for people how to tell the difference between a sunspot, which are super crazy common, and melasma, which is common, but not nearly as common as
Right.
sunspot? So how
So
can you
I
tell the
love
difference?
Yeah, I loved when you used the word geographic, right? When it looks map-like it's a
Yeah.
little island that you could draw or an ants around it. That is when it's more likely to be melasma. As I mentioned, that symmetrical kind of quality, especially if it's nose and cheeks, that's kind of like the most common areas as a giveaway. Versus hyperpigmentation from the sun is usually more kind of has a more freckle-like component to it and more diffusely distributed across like everywhere that you're exposed to the sun versus melasma tends to be a little bit more focused. And then, of course, that's in contrast to what we call post-inflammatory hyperpigmentation, which is pigment that's a result of usually some sort of inflammatory process like acne, or you had a little scrape or scar or something and leaves a little brown spot behind. And that's all like different ways that pigments show up. And unfortunately, of all those different things, melasma is the most difficult to treat.
Yeah. Melasma is, well, so I think of it, and you tell me, it's
Yeah.
kind of a chronic inflammatory problem. It just doesn't really totally go away. So you can make it look a lot better and hardly noticeable, but then it can flare up. Can you talk about the things that
That
make it kind of
that is
flare up?
yeah, that is the best way to think about it. It is a chronic component. And before we talk about what flares it, understanding that there is a deep, long-term inflammatory process to this. This is actually core to part of what's going on. It means when we
Right.
think about treatment, we need to think about the inflammation component. We know that it has a vascular component. So blood vessels are both larger in size and thicker and denser in the area of melasma. And then also, it has barrier dysfunction, which means that the skin itself isn't working quite correct, as well as all the hormonal things. Another thing to think about is always check someone's thyroid if they really have recalcitrant or resistant melasma. That's something to think about, is checking those hormone levels as well. And then there's a big genetic component. So if you talk to somebody, it's highly likely that the women in their family may have had this, and especially with men, the genetic component's even richer.
Hmm.
So to understand, because it's all of these components together, and there is that kind of hormonal, genetic, inflammatory, chronic inflammatory component to it, it really does become a lifelong challenge. And that's really important to understand as a patient, as a clinician, because we really can make things better. But if you don't change the lifestyle components, we can't keep the like we can get it better, but we can't maintain it staying great if we don't change the lifestyle components, which goes back to your question of what triggers it, right? What tends to make it worse? The sun absolutely does. So like I can get somebody completely better, and if they go out to the sun and aren't diligent about sunscreen, and I really like people to use hats, walk in the shade if you have the choice when you're walking down the street, it can flare in a day. I mean, I that happened. I have
Yeah.
melasma personally, and that's happened to me. The other thing is hot yoga is the one like bane
Mm.
of the dermatologist's existence sometimes. And somebody, you have to like get into those conversations of like, oh, do you happen to do hot yoga? And often that comes out that they're doing something that really brings up their core body temperature. And
Hmm.
that may be something that's underlying. And even places like, Scottsdale, where it's hot 6 months of the year, people will find that it's not just the sun exposure piece, but actually the underlying heat
The
that could be
heat.
that
Yeah.
constant chronic inflammatory producer.
Yeah, like saunas too. I've heard a
Exactly.
lot. Yeah.
Yep.
So let's talk a bit about how to treat it because there's so many modalities to talk about here. The way we got kicked off onto this topic is because we both feel very, very, very strongly that lasers are a very bad idea. So can we start with just that? And let's talk about like how the lasers work to lift the pigment and then also why that's a problem.
Yep. Okay. So the the thing is there's multiple different types of lasers and what we call
Yeah.
intense pulse light, which is a light wavelength rather than a specific laser, an energy device, right? That are FDA approved for melasma. And so often clinicians are like, oh, great, this is what I'm going to use on all my patients. And unfortunately, because of the fact that laser puts heat and deep energy to go in often to try to actually when it goes after pigment, you're literally exploding the cell. That's actually how it works. That's often these lasers are lasers that originally designed to either heat the pigment that's in a hair follicle, like in a hair removal laser, or it's a laser that's going after tattoo and it's going in there to it literally explodes the pigment and the dark color so that your own immune cells can go in and eat up that little pigment. But the problem is because melasma is so chronically induced by heat and temperature, as well as just an inflammatory process, it may get better the first time. It may even get better the second time you do it. You're like, yes, I'm going to clear it the last time. And the third time might be the time where all of a sudden post-inflammatory hyperpigmentation plus melasma triggers back up. And now you have a situation that's even worse and more recalcitrant. So as a
Yeah.
general rule, my rule is no laser for melasma, period, unless you are in the like absolute laser specialist, the one person in
Right.
your city who's been doing this like and it is recalcitrant that has not gotten better after years and years, and you tried everything possible, and even then it should just be these like super fast pico lasers that are like the smallest little bursts of energy possible. And honestly, not that many people have these kind of lasers, and they still have to be in super expert hands. So a
Yeah.
general rule, it's much easier just to say, please,
Please don't do it.
no
Yeah.
laser on melasma.
I mean, unless you are dealing with a really, really advanced laser expert,
Yeah.
doing this on melasma is just not smart, because you're basically blasting through the melanocytes, and those are the cells that are making pigment, right? And you
Yep.
can just piss them off, okay?
They just get
And they
angry.
get mad, and they just are like, you know what? I'm going to make tons more than I made before. So just, just because
Yeah.
you annoyed me. And the thing is that, and I will say that, so that when I talked to this other expert about it, she's like, oh, yes, there is that possibility of rebound. That's why we always pre-treat people. That's why we always treat people afterwards to prevent that from happening. And so, in her hands, it's like, well, we can prevent some of the rebound and I just call it rebound, right? Which
Yeah.
is,
Rebound's a
I mean,
perfect word because
in
that's what it is.
my,
It's
yeah,
rebound and worse. Yeah.
right. So the thing is that a lot of times people are super happy because the laser cleared the pigment and they're like, woohoo, it looks amazing. Okay. Which it does. Okay. It does clear the pigment that's there, but it's also triggering this rebound response from the melanocyte that takes months to happen. So now what happens is it comes back even worse than it was before, but they don't necessarily blame the laser. They don't even realize it's because of the laser. They're thinking, oh gosh, it came back. It's all my fault. I went in the sun, da, 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 da. When really, a good third of patients, it was the laser that triggered this rebound. And so that's the trouble that I have with it, is I don't know which third that's going to be, right? So I don't know, of all the people coming in, which one is going to be the problem. But it doesn't matter to me, because for me, if there's a chance that I'm going to make someone worse than they are today, I'm not going to do it, right?
Well, this is when it comes back to medicine, right? First, do no harm.
Yeah.
Like if we don't know who
That's
this
like
is,
really
it's
bad odds.
comfortable.
I mean,
Yeah.
maybe if it were 1%, but even 1%, if it were 1% and you just needed to pre-treat and then post-treat and make sure that their melanocytes were suppressed, and you could somehow deal with the 1% and they wouldn't get mad at you, maybe. But it's a good third. And that's why, so if you're listening to this and you have melasma, let's talk about every other thing that we can do to treat melasma, because we have really great treatments for melasma.
You are
So,
exactly right.
okay.
And I think because we do have the alternates, that's why we don't have to do laser. It's just like because there's so many things that are so much better. And I
Exactly.
discovered these things because I made my own melasma worse during my laser fellowship. Like I am the poster child. That's literally the reason why peels came into my life in the early aughts. And it was realizing as a result that superficial chemical peels actually work so much better. And it's one of these things where I think people think, oh, I want to go big guns and make it go away and whatever. It's like, no, melasma needs kindness, right?
Hmm.
It needs a gentle, and so doing a series of superficial chemical peels along with appropriate home care is, in my opinion, the best way to approach it.
So we talked a whole bunch about peels last time, but let's launch into. So first of all, what is a chemical peel? But then specifically, what are the ingredients that help with melasma and why?
Okay, so superficial chemical peels, traditionally the thought process was you are lifting the top layers of the skin, which means you're lifting those layers of keratinocytes that have an overabundance of melanosomes in them, right? It's already been deposited, so you're wanting to lift it. And then you're also making use of the ingredients in the peel that are anti-inflammatory and also tyrosinase inhibitors and also antioxidants to turn off the melanocytes that are already triggered and turn on too much. So by using peel ingredients that are anti-inflammatory, things like salicylic acid, mandelic acid. Sorry, I've got a little bit of allergies, so I'm like getting nasally. Okay, so we're going to use the peel ingredients that are really great anti-inflammatory. Salicylic acid, that's what the primary ingredient in aspirin is, right? So it's a great anti-inflammatory. Then you're also going to use things like mandelic acid. Lactic acid also works incredibly well. And lactic acid has the advantage of also really hydrating the skin. And as I mentioned, barrier dysfunction is often a piece of melasma. And then I love to use TXA, trans-examic acid, in my chemical peels as well. That's some of the formulating I did recently for the Linder Health peels, and specifically put trans-examic acid in the hero peel because it has the advantage of not only cell turnover, turning off tyrosinase, which is that pigment inducing ingredient that makes the make more melanosomes and darker melanosomes, but it also has this advantage of being a fibrinolytic, and it actually works on the prostaglandin pathway as well, which means really robust anti-inflammatory. And also what is cool is it makes the cells make a smaller amount of vasculature. So I mentioned earlier that we know in melasma that you have an increased number of blood cells and increased density. So by actually turning that down and turning off some of that inflammation, using the chemical peels, you actually can get all of the pigment and the causes of the pigment to start calming down. And that's the thing. And so I really like, as I mentioned, to do these more superficial peels. Do them as even as frequently as every 2 weeks. And that'll actually start lifting the pigment. And something for people to know is the first couple times you do it, your pigment might appear darker. And that's because the pigment's actually rising to the surface. So just for them to know, just because it gets darker a little bit at first does not mean it's not working. It's actually kind of lifting sometimes.
And for that, for the hero peel you mentioned, this is the Linder Health specific peel. How many of those do you have to do in order to really treat melasma
Often
thoroughly?
three is
Mhm.
often plenty. You'll often see a result even after one, but sometimes, like I mentioned, it can get darker. Three is typical, and sometimes it's six. And then some people, honestly, it becomes a relationship with your dermatologist. You might do a series, get under control, and then you come in semi regularly, maybe like once or twice a year, just to maintenance. And
To
then if
touch
you
it up. Yeah, I
touch it
have
up.
definitely found that as well. It's like because it's a chronic inflammatory condition, people will come back eventually when it's starting to come back. And ideally, you kind of nip that in the bud before it's gotten really bad and you can maintain it with these peels. And
Right.
so,
And,
yeah.
and there's lots of peels out there. I mean, there's so many different manufacturers of peels, and there's different things you'll find in your esthetician or your dermatologist office that can be beneficial.
Mhm.
But going specifically after some of these ingredients like mandelic, I try to avoid glycolic acid usually for post-inflammatory hyperpigmentation or melasma, simply because of the fact that it often will dehydrate the skin a little bit. And as I mentioned, the barrier is often a component that I don't think we realized beforehand was as important. And the same thing with the mast cell component, which is part of the inflammatory component.
Mhm.
So I try to avoid glycolic, but all these other ingredients like lactic, salicylic, mandelic, especially can all be beneficial and kind of help with that process.
And so if there's a barrier component to it, staying really well moisturized is also really helpful, right?
Absolutely. Like, do not underestimate how important it is to keep the skin super hydrated and moisturized. I think you and I talked about this last time. One of the things
Mhm.
that we know for healthy microbiome to have the cells work regularly is not only to be acidified semi-regularly, so it's acid like from a peel, but moisturization is the number one most important thing for a healthy microbiome. So it's don't underestimate. And don't use, if your skin feels squeaky clean from soap, squeaky clean is a bad thing. Don't do that. Yeah,
You really want the skin to feel soft, supple, and moist, right?
exactly.
So let's talk about skincare for melasma. So besides doing a series of peels, which is our both of our like favorite thing to do, what are the basic components of skincare to battle this chronically?
So one of the things that people traditionally have probably heard of, are the triple creams. And so these go back to the 80s even, and that was a combination of hydroquinone, a vitamin A like retinol or retin A, and then a steroid. So this was what dermatologists used forever. I will say, I no longer like to do this. So I
Hmm.
bring it up just because I'm asking, let's not do that anymore. And the reason why is this. So yes, the hydroquinone would help to turn off the pigment and help to lift it, but it was quite irritating. And as a result, we would have to use steroids to calm it down. The same thing with the retinol. It was helping to do cell turnover and helping to lift the pigment, but the same thing, it was irritating the skin and we'd have to put steroids on. So you're using the steroids to calm things down, but then the steroids also increase the amount of blood vessels. So you're like
Yeah.
going forward and backward, all these other things. So in a general rule, please, I recommend not doing the triple creams, whether or not it's Triluma or the compounded ones. So there's
Yeah.
other ingredient. Yeah, go
Yeah,
ahead.
I think that in general, people should know like chronic exposure to steroids in any form really is not a good idea. But specifically for the skin, it's going to chronically, I mean, if you use it for long enough, it'll really thin your skin, right?
It'll thin your skin and increase the number of blood vessels in the skin. So the
Right.
skin
So
all of a sudden
not
looks
we don't
red.
want that.
Yeah.
So I think yeah, so I totally agree with you. I really object to chronic use of steroids really
Yeah.
for anything.
So the things that do work well is we've kind of take that idea and then what can we do instead? So antioxidants, amazing for melasma. So whether or not it's vitamin C, which is everybody who has melasma should be using a vitamin C based product. I tend to like things that are L-ascorbic acid. That's the one
Hmm.
that is the most bioavailable, but it needs to be in a form that's stable. So something that's either silicone wrapped or it has some sort of component that allows for increased absorption. So usually these are not your cheap vitamin C products that you're going to find at Sephora. You need to have something that's a little better quality. Then there's all sorts of different botanical products that are out there that are antioxidants that are supported, whether or not it's licorice root, or then there's things like arbutin and all these other things. Azelaic acid is also quite helpful for cell turnover and tyrosinase, turning those things off. One of my new favorite ingredients is something called tetrahexyl decyl ascorbate. It's a cousin of vitamin C, so it has many of the vitamin C components, but it also has some additional things that actually help with both UV visible light as well as antioxidants and some other cell turnover things. So this is one of my new favorite ingredients when it comes to pigment control. And then the other things to really think about are you want to avoid hydroquinone, you want to use antioxidants, you want to do things like moisturizers, which we said is super important. And then
What about tyrosinase inhibitors?
yes, tyrosinase inhibitors across the board. So that is everything from licorice root. And my favorite ingredient across the board is niacinamide for
Mm.
pigmentation because of the antioxidants, because of the tyrosinase inhibitor, because of the support around inflammation. So I think everybody should be using those kind of things. Do you have any favorite tyrosinase inhibitors that you're using currently?
Well, yeah, we have one over-the-counter product that's the Skin Medica Even and Correct that
Uh
has a
huh.
bunch of different tyrosinase inhibitors in it. And that is kind of my right now anyway. But we change, we reconsider. I'm curious to know what things that you use. We went through a big evaluation of that about a year and a half, 2 years ago when Skin Medica, that's the maker of that one, rebranded the previous one. And since they were rebranding it, changing their formulation, I did a little deep dive back then, and I asked everybody I knew, like, what do you use? What works best for you? And I got samples of all those, and did our own. Like all my whole staff used those, and the Even and Correct, which is the new brand of the Skin Medica one, that won. So we went back to that. But there are so many of those that, I mean, everybody's kind of brand loyal, which I'm not. So
It's good
I'm
to
curious to
explore
know which
different
one
things
you.
and experiment.
Uh,
So I will say right now, partially because I'm currently doing product development is, and as you can imagine, because my personal history, like that is what I'm really spending time on is doing a combination of something that is tetradecyl ascorbate, niacinamide, some other arbutin and antioxidant supporters, and then used in combination with a TXA topical. So trans-examic acid, which is the one
mhm.
I mentioned
Yeah.
that really works on the vascular and inflammatory component. And that product, you will find topical products out there currently that are TXA topicals, but that is a very difficult molecule to do product development with to keep it bioavailable. And so that's the reason we put it in the peels is the peel actually allows for additional absorption. So what I'm working on
Mm.
right now is getting a way to get it additionally absorbed. So that's what I'm currently doing. And as you can imagine, I'm doing clinical trials. So that's what's coming down the line. But there's
That's
some other
awesome.
interesting ingredients, like there's like cysteamine or some things that are interesting. You'll find things with one from L. furfur, which is like from a yeast, which is Melasma, and then even topical metformin. This is kind of a fun one that's
Oh,
interesting.
that's interesting.
So there was a study out there. I don't know of any actual clinical product that's out there yet, but that's something I think, keep your ears perked down the line. I think we're really aware that senescence and cell longevity and thinking about those zombie cells have a role in pigment as well. So I think that's the reason why the metformin piece is potentially in there.
There was
Find well as well
uh,
for their new ingredient.
the Skin Medica product had a new ingredient that was some part of the lotus plant, I think, that was supposed to actually break up existing pigment, which is the
Mhm.
first topical product that I've seen that claims to do that. And they had some basic, research supposedly showing that, but I did try some of that. They make a spot treatment on a little post-inflammatory hyperpigmentation that I have from a long time
Mhm.
ago, and it did work temporarily. It really worked on that. So I thought that was really interesting, but I don't know enough, like that there's enough data to say that it really does that, but that's what they claim.
I think all of our different botanicals really often work in a combination of tyrosinase inhibiting, breaking up pigment, lifting pigment, and most importantly, that antioxidant component is usually what we
Hmm.
find anything
Yeah.
sort of botanical based ends up coming down to. And they all have advantages. And I think when it comes to pigment, it's a combination of ingredients that usually ends up sort of being the magic bullet, because it's
Hmm.
not one magic bullet. It's sort of you got to almost got
You
to
have
go
to
a little bit more
attack it from
shotgun
all
approach.
different directions, basically.
Yep.
Yeah.
That's really the way it works.
So I'm really interested to know whether you ever prescribe oral tranexamic acid to patients. We do that as a kind of a last resort when all else fails and someone has really recalcitrant, just completely resistant to everything else. Curious to know what you think about that.
That I function in the same way. For me, it is that patient that has failed everything, and we need to do something to sort of like get things going.
You want to
And
explain why it's a bigger deal, why you
well,
just don't prescribe it to everyone?
Well, one, you really do need I do think it's important to check, clotting factors on
Hmm.
everybody, because it does have a risk. Although it is a medication that is designed for when people are clotting too much, traditionally used surgery, people with bleeding post-pregnancy. So it's designed to actually break up clots and keep clots from happening, but it actually has a risk of making clotting worse. So if somebody has clotting factors, it can be risky. You don't want to do that. In terms of studies, because this is a short-term medication, this is not something we've done long-term studies on. And I
Yeah.
think most derms I know are not comfortable for, like, 4 months would be the absolute longest amount of time that I know anybody will do it for. And then you're wanting to, once before you even get to that point, you're wanting to start to taper off. Or usually if I'm doing it, I'm doing it twice a day to start, and then try to get them to once a day quickly and then get them off. And it really is that risk around the clotting component, what's going on. It's a medication that's not really designed for long-term use.
Yeah. So I think our protocol is 8 weeks and then with a follow-up visit and then potentially adding 4 more weeks to that.
Yep.
And the reason is, that we're worried about clots is because people can throw a clot into some important part of their body, like their lungs or their brain, and that would be really catastrophic. So we don't want to, contribute to anything bad happening.
Right.
And
It
the
is
other
not
thing
worth
is,
time. It's not worth
yeah,
having a stroke to
it's
lift
not
it.
right. It's not
Yeah.
worth. So a lot of women are on hormones, and hormones can increase your propensity to clot. And so one big contraindication to using this drug, the tranexamic acid as a pill, is already being on hormones, right? So now you don't want to have yet another thing that will increase your likelihood of having a clot. So we take it very seriously. I have had, here I'm in Seattle, we have a huge Asian population. I've had patients say, well, everyone back, where my parents live, they're all taking this. And I don't know what the dose is or anything, but I just find that, anything that is risky, we are very, very careful with, right?
I completely agree. And to be
Yeah.
super clear with people, that means Nobody that's taking birth control pills, no one that's taking
Right.
hormone replacement therapy.
Right.
If somebody is a smoker, that really increases your risk of clotting
Yes.
as well. If you're somebody who regularly taking long-term flights, you're not doing this. So it's really a small fraction. And I just recently came back from the big cosmetic conference that happens in Paris every year. And so when we get together in these big conferences to talk about things like melasma and hyperpigmentation, we have doctors from all over the world. And yes, doctors often in Asia are doing it. And usually it's 250 milligrams or 250 milligrams twice a day. But they also, these people that are the expert in the field, are also saying, as you did, we're talking 2 months, 4 months at the most, where this
Yeah.
is not something that should be used chronically long term. And unfortunately, you'll find people that are willing to do things. The same thing goes with glutathione. You hear about people doing glutathione IV. Not a good idea. And it's actually been shown in the clinical data to actually not be beneficial. I think it's more people are having placebo effects from it and they're taking increased risks from doing it. So I think we need to be
Yeah.
really careful with first to no harm.
The reason that I bring it up though is that it really works really well. So that's
Yes,
the
it
problem
does.
is that, if all else fails and you are on birth control pills or something, but you've got terrible melasma, it's not responding to anything, potentially you could get off the pill, stabilize, get back to normal, and then do a trial on oral tranexamic acid because it actually really is remarkably effective for
It is
melasma.
incredibly effective. Pearl Grimes, who's really an expert on melasma, who I deeply respect. I mean, she says one of the problems with putting people on TXA is trying to convince them to get back off of it,
Right.
right? Like that's the hard
Right.
part. And the last thing we want to do is have patients, doctor shopping and like getting it from here and getting it from here. Next thing you know, like they really
Right.
are putting themselves in a risky situation. I mean, we found that with hydroquinone, right? It's like that was a lot less risky. You were just getting people getting much worse melasma and not realizing it was that they were doing high dose hydroquinone long-standing over time. And even outside of orchinosis, they were often just making their melasma worse from the inflammatory component. So I think
Mm.
that's one of the additional reasons to be careful with it.
Really, really interesting. So, what about diet and lifestyle? Can you talk a little bit about that?
Oh, yes. So, as we mentioned, that thinking about heat, thinking about inflammation, those things are important. But the number one most important thing is sunscreen. If somebody is not willing to wear sunscreen, there is no reason to even start the process. This is, if you are a melasma sufferer, it is a commitment. I personally keep my sunscreen right next to my toothpaste. When I brush my teeth in the morning, that sunscreen goes on right away. And the thing is, often because of the fact that melasma often, you can get it in pale people like me, but you can also really get it in people with darker Fitzpatrick's. And so understanding that, yes, even if you have darkly melanated skin, you should be wearing sunscreen no matter what, but you should really be wearing sunscreen if you have melasma to try to get it under control.
Completely agree. If you can get, like, we call it a Seattle sombrero because it, also blocks the rain. But if you get a nice wide brimmed outdoory hat, when you're gardening or it's really, really helpful. Just keep the sun off your face. What about diet? And do you think an anti-inflammatory diet helps with
It is
melasma as well?
definitely worth trying. I think doing these anti-inflammatory diets, I do think a big deal. I will personally say I discovered after having a nanny that had celiac disease, which means she could have zero gluten. The whole family
Mhm.
just made easier, just not. And all of a sudden I realized, oh my gosh, I'm actually super gluten sensitive. And getting that stop and eat gluten for me turned my inflammation off. And I think it actually had a benefit on my melasma as well as some other inflammatory things. So I actually think it's worth trying anti-inflammatory diet. And I also think it's worth doing things like staying away, using if you're I personally am a big milk drinker. My body does well with it. But if you're drinking milk products, stay, doing organic. So just even the little bit of hormones that we kind of can find in traditional milk products, I think can have enough hormonal effect on those of us that are super sensitive to hormone regulation and pigmentation.
I've been really surprised by that too. So interestingly, I'm also gluten free. I had a chronic cough for 25 years before I randomly figured out that it had to do with stuff I was eating. I'd even had a big, massive workup by various specialists, and nobody could figure this out. But what I found was, staying away from inflammatory foods, but especially gluten, made that, 98% go away.
It's
And
amazing, isn't it?
yeah, and I have patients who have other, autoimmune diseases where they control it completely through diet. If they do a really strict anti-inflammatory diet, especially like the GI ones like Crohn's disease and ulcerative colitis, if they do anti-inflammatory diet, then those symptoms go away. Same thing with arthritis and rheumatoid and stuff. So, and for any chronic inflammatory condition, you would think doing an anti-inflammatory diet would be helpful to reduce that. I just have never had the ability to convince anyone to try it.
Well, I developed Lyme's disease a few years ago, and
Ah,
that's actually right at the time frame where this gluten thing was starting to happen for me, and that definitely had a positive benefit. I, of course, did the 6 months of doxycycline as well, and all those other things. I was lucky enough to show up on the titers, but I did find if I ate gluten, all my joints and everything just
hmm
went wild. So I do think there's something to it. If somebody's really want to do everything they possibly can, it's worth a trial. These are things we experiment with, right?
right.
So
Yeah.
these aren't hard and fast things, but it's worth trying things to see if it makes a difference for you.
So is there anything else that is in your arsenal for treating melasma? And if so, like what would you advise our listeners to do
So
if they're
patience, I think, is the number one thing. I
having
think
patience?
that really
That's
is the
asking a
part that
lot.
it takes. Yeah, I know. It's just being like, okay, this is something that is, it's like radical acceptance and then being committed to doing everything we possibly can to make it better. Do think it's something where empathy and hand holding is important. That's part of the reason why I do love chemical peels is that somebody's on the table. You're having that empathy moment where you're connecting with somebody and talking about it. And I think that piece of being really connected to somebody is part of the healing journey as well.
Yeah, and I think it's important though to encourage people that like we really do have really great treatments for melasma. It
Yes,
is
we do.
very possible to get rid of it to the point where it's just not that noticeable. And the vast majority of people, I think, are able to get to the point where they're not putting on a lot of makeup every day. So
I
we're
would
really
completely concur.
yeah, so we're really able to make a giant dent in it, if not get rid of the process, because once you're diagnosed with melasma, the likelihood of getting rid of that and having it not ever be a problem ever again is maybe as close to zero as I don't know, as
Yeah,
anything. Yeah.
we definitely can make it so much better.
Yeah. So just to summarize, so we're talking primarily a series of peels, skincare, lifestyle changes, but specifically sunblock and staying out of the sun and heat, avoiding triggers. And then if all else fails, potentially a trial of oral tranexamic acid.
Yep. The one other thing I would like to bring up is just if somebody has pigment on their face, especially if it has a little bit of a gray cast, and they've noticed they are losing hair along their hairline,
Mhm.
I encourage them to go and see a dermatologist because there is something called lichen planus pigmentosa, and it can cause a fibrosing alopecia, scarring alopecia along the hairline. So if
Mhm.
someone's noticing that it seems like their forehead's getting bigger and their hairline's going back, I encourage them to really see a dermatologist because of the fact that it might be, rather than melasma, it might be this lichen planus like pigmentosa, and you
Mhm.
treat it differently. And in that case, you really have to go strong anti-inflammatories, and we often use steroids and some other things. So I always like to bring that up because we are seeing more and more of that happening, and we especially see it in the African American population, but we can see it across all different culture and ethnicities, but often in that
Mhm.
case. So something just for somebody to think about.
Yeah, I think it's really important if you are going to see a non dermatologist like me. Okay. For anybody who is not a skin disease specialist, right? If they are not sure what it is, then you need to see a
Yeah.
dermatologist. And, every time somebody asks me, like, well, doc, can you look at this lesion? I'm like, no, go show that to a dermatologist. That's not what we're doing here. This is not my area of specialty. And that's the other thing is if you're not totally sure what it is, you need to get that diagnosed properly.
Yeah.
Yeah.
And then you can go back. Like dermatologists love having great relationships with people. Like we can clear things, and then you can go back to the person that you love getting your treatments and facials from,
Yeah.
and we can work hand in hand with each other.
Yeah, absolutely. Well, so Jennifer, is there anything else that you'd like to leave our listeners with? And also, can you let everybody know how to reach you and all your
Yeah.
various practices?
The easiest way to get a hold of me is on socials, and I'm at Jennifer Linder, Linder, MD, or you can reach me at Linder Health. And those are my socials. And I love talking about nerdy things and asking questions. And so please reach out.
Well, thank you so much. And we will have those links in the show notes. And so, Jennifer, thank you so much for talking with me today. It's been really, really interesting.
I always enjoy our conversations.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website MedSpaMayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.